Hello, everybody. Today's conversation is about far more than cosmetic dermatology. It's about identity, confidence, aging, self perception, and the emotional complexity behind wanting to feel like yourself as your face, your body, and your reflection change over time. Because for many people, aesthetic treatments aren't really about vanity, they're about alignment, deep human desire for the outside to reflect how we feel inside. But where's the line? That line between healthy self care and chasing something that's maybe impossible. How do you know what to treat and what not to treat? And what happens psychologically when appearance begins impacting confidence, relationships, work, intimacy, or even how someone moves through the world? Well, my guest today has a lot of answers for us. Her name's Dr. Lynne Haven. She is a highly renowned dermatologist and MD, and this is going to be an unusually thoughtful conversation about the mind-body connection, age, beauty, perception, and the emotional weight that many people carry around about their appearance. She draws from decades of clinical experience. Dr. Haven shares what she's learned about why patients will seek treatment, the psychology behind those aesthetic decisions, the importance of restraint, and what we all want, natural results. So we're going to be talking about the art of keeping people refreshed without losing themselves in the process. We'll also cover some of the pressures created by social media, filters. Oh boy, that's a big one. Comparison culture, perfectionism, and why the best cosmetic work is often the work you don't immediately notice. So let's please say hi to Dr. Lynne Haven. Thank
Hi,
you, Lynn.
Dan. Thanks for having me.
My gosh. So I have a first question. What is the number one reason most people pick up the phone to call you?
I would say the number one reason is that people want to be more vital and more like themselves. They'll notice something starting to change and they'll want to address that.
And how do you go about having those conversations with someone? How do those conversations start when someone comes in?
Really start, the most important thing is listening, for me to really listen, or whatever provider they're seeing, to really listen and get a deeper understanding of what the concern is, as well as who they are as a person. What's their lifestyle? What are their hobbies? What are their habits? What are their work commitments? What things are bothering them the most? How have they done in the past? What have they been treated for? And then we can make a plan going forward.
That's very interesting. So it's kind of like you're creating a big mosaic picture.
Exactly. Yes, you're looking at the big picture because, I mean, our overall health and vitality, it really does impact your skin and vice versa. So you want to look at the big picture, and then we dial down and zoom in on what the particular, problem or concerns are to address them. Yeah.
It's interesting. Well, we're living in the world of social media filters.
Mhm.
Which, I mean, it's such a funny phenomenon because you can filter yourself all day long. I'm
Yes.
sitting recording this in front of a 5-foot circular bright light, which I love
Yeah.
because I like to walk all day long because it removes every wrinkle from my face. Almost. But obviously that's not possible. And the more we get used to, the more phone technology improves and knows. How do you sell the new iPhone? Well, you improve the
Right.
camera. What counts as
Right.
an improved camera? We look better in it. We like what we see.
Right.
How's this impacting when people come to you?
Yeah, it definitely impacts sometimes because they could have an unrealistic expectation, or they see someone that they're, follow. I mean, there are even images where it's with augmented AI. It's not even a person anymore. So, but I think social media overall is a net positive because there's so much information. So people are better informed. There's some misinformation out there, and that's a huge, problem. But in general, people are taking more interest in their skin, their health, their longevity. So I would say for most people, it's a positive. But you're right, you do have the little bit of the comparison culture where people have some unrealistic expectations. I mean, during the pandemic, when Zoom, became such an important way of communicating, and people doing work and school, and people would really be freaking out about how they looked on Zoom, and I would have to educate people, like, most of us look better in person than we do. That's a certain angle, or that is not, how people look in real life.
Mhm.
And I think, yeah, some people have become sophisticated in terms of how they position the camera and how they do the lighting but in the old days, people would come in with a photo and say, "Oh, this is a terrible, look how terrible I look." And I'm like, "Really? That's a camera angle. Let's go scroll through your roll." And there are some that look really beautiful. And, so I'm glad to treat what's there, but I also have to educate people not to overtreat, not to treat what's not there or what's just perceived to be a problem when it's really not a problem. So
You
it
know,
can go both ways. Yeah.
you raised such an interesting point because I remember over the years when I used to go get my hair cut by other people, I'd find this haircut and I'd bring it into the hairdresser and never took into account their hair texture versus mine,
Absolutely.
the face versus
Yes.
mine. And I walk
Yes.
out disappointed
Right.
because they don't look anything like that gorgeous, fabulous face.
That is so true, and that applies 1,000% to cosmetic dermatology, right. People will come in I feel like maybe 10, 15 years ago, people used to come in with a celebrity, "I like this, I want that," and now people are often coming in saying, "Well, what did my friend do? What do I" and, medical confidentiality, I'm like, "I can't tell you what your friend has done," but furthermore, it's so personalized, what your friend needs might not be what you need or what you would benefit from the most, so we really have to get very personalized and break it down for everyone.
Psychologically, what do you think the motivation is when somebody's thinking about, I want to change something here? You're a medical doctor first,
Yes.
became a dermatologist. So I'm curious what you
Right.
think in that overall big picture.
Well, there are many different motivations psychologically. I mean, major life changes are often a big motivator. Someone's planning for their daughter's wedding or their wedding, someone's graduating, someone's up for a big job promotion, and this is a young person's field and I want to look confident. Menopause, there's a huge change. We could have a whole podcast just talking about skin and health changes with menopause. And so, again, I would consider that the menopause transition something where someone's going along, living their life, and then suddenly there are pretty dramatic changes. It's estimated you lose about 30% of collagen in the first 5 years. So
Hmm.
it's not necessarily always about someone wanting to look different. It's really wanting to look the same and be healthy and vital. And yeah.
There are a lot of people on the GLP-1s.
Yes.
Are you noticing a increase of inquiries for cosmetic facial dermatology with that?
Yes, actually. Well, we should definitely talk about GLP-1s because they are so prevalent. It's estimated maybe 1 in 8 people are on them or have been on them. And they have pretty significant effects on hair, skin, overall health. So I'm sure everybody's heard of Ozempic face, and it's not really confined just to Ozempic, it's all of them. And that sort of refers to volume loss, but it's not just that it's structural, it's the skin quality. So there are definitely things we can do to counteract that. And another huge problem, and maybe even up to a third or some studies even more, people will actually have hair shedding and hair thinning. So, between the collagen, the facial structure, and the hair, there's definitely a role for dermatologists to play and to help mitigate some of those side effects. The interesting thing that some people might not know is that if you start treating some of those, you can mitigate a lot of those side effects if you start treating early. So some people on GLP-1s might not have good counseling in terms of proper nutrition. So you need the micronutrients, you need adequate protein. There are things that we can do for the hair, maybe even just nutraceuticals that help maintain the healthy hair, as well as just kind of going low and slow. So keeping the weight loss at a reasonable rate and a slower letting the body adjust. And then of course there's the lifestyle factors of building muscle and maintaining your muscle mass because we know probably about 40% of weight loss when it's drastic weight loss comes from muscle. So
Hmm.
I actually have some really cool devices in my practice that I love I love for normal aging, but particularly love also in the GLP-1 situation. Um, for example, M Face, which does non-invasive tightening in the face, tightens the skin, but also the muscle. So the muscles that lift here and here and the under eye. So you can actually build or maintain that muscle mass that happens with normal aging or a GLP-1. And then we have a companion device called M Sculpt Neo where we can build muscle on the body. So abs, glutes, arms, legs. So it's really it has a functional component. So people with, back pain or orthopedic issues or normal aging, but also a cosmetic component. So
Wow. So you
it's
can you can kind of solve that age-old Sophia Loren quote where she said, like at 50, you have to choose between your face or your ass. You're saying,
You are
okay,
right. We have solved that problem between modern technology, more knowledge, and modern fillers. Yes. Things are not always quick to solve, but solvable, yes.
what are the biggest things that men and women might experience differently as our skin, our faces, our bodies age?
Mhm. The major differences is the hormone fluctuation for women. So at a younger age, there can be hormone related acne. And then at perimenopause and menopause, things really, start to diverge and change quite a bit.
Mhm.
As well as pregnancy, that women that have children undergo a lot of changes. There can be, melasma, pigment changes with pregnancy. There can be diastasis with separation of the abdominal wall. So again, the Emsculpt Neo can help to mend that muscle after delivery. So
What
there are
age?
differences. I would say that in general, women tend to be a little more attuned and to start a little bit earlier in terms of noticing some of the things, addressing some of the things, being proactive. Many of my male patients are increasing, and which is great. But many of them are, they've heard about something from their wives and or girlfriends, and so that's changing. But I feel like in some circles of men, they don't necessarily talk about it one amongst themselves like we like to share our advice.
What's the age that what age might someone start to come see you or a cosmetic dermatologist?
Well, I mean, I really treat both sexes, all ages, but for the cosmetic dermatology, it depends on what the problem is, right? So some people might start relatively young if they have acne or acne scarring. And again, the sooner we can start to treat that, the easier it is to treat. But for some of the other cosmetic procedures, it starts later. Yeah.
One of my favorite books from back in the 70s, which you probably were read, was Psycho-Cybernetics, about the impact of surgery on someone's self-esteem and how they felt about themselves. What have you
Yes.
observed in that in your practice?
I really see that impact every day that the psychological benefits of treating something that bothers you. And sometimes it's a very simple treatment and it's just been weighing on someone. And then there's like a weight lifted, and then they have psychologically freeing more energy to think about other things or just feeling vital and healthy and feeling like they're taking care of themselves and they're doing something for themselves. So I think and, healthy skin, healthy aging, vitality, they're all very interconnected. It's particularly how someone sees themselves, but it's also how the world perceives, someone else. So there is, for example, Botox, where we do the most popular area. That's the most popular procedure in America and worldwide is Botox. Treating the glabella, where people hold that tension and anger and look like they're scowling even when they're not, when they're just squinting and so people will actually feel more relaxed. They've done studies, the mind body connection, showing that by relaxing that, you feel more relaxed and there's
Very
less
interesting.
stress. But someone else is going to perceive you as more friendly and not, looking as angry. So it sort of goes both ways.
It's funny, you're touching on emotional weight, the emotions that get tied to how a face is perceived.
Yes.
Can you expand on that? Because it's an interesting perception to contemplate. How our faces reflect
Well, I think our
how
faces really are our humanity, a big part of our expressions, what even if it's verbal or nonverbal comes from, expression and how we relate to one another and how we feel about ourselves, how we, show ourselves to the world, and are we comfortable in our own skin and in our own faces. So
Mhm. What is the difference where it's cosmetic surgery versus cosmetic dermatology?
Great question. And some dermatologists do surgery. We do a lot of skin cancer excisions, but so plastic surgery would be procedures like a facelift, a brow lift, an eye lift versus cosmetic dermatology. We really specialize often in the non-invasive treatments. So I sort of like to break it down when I'm doing a full cosmetic consultation in terms of skin quality, skin issues. So that could be red spots, the vascular red spots, that could be brown spots, age spots, sun damage, acne, rosacea, precancers. And then there's the structure of the face. So non-invasive tightening. So we have thermage, which is radiofrequency. We have the M face, which also addresses the muscle component that I spoke of. We have fillers, which can lift and smooth. And we have a whole range of fillers structurally that can be used to sort of replace the lost volume, or maybe people have asymmetry from, naturally or after, Bell's palsy or stroke or whatever, and Botox. So you have the quality aspects and then you have the structural aspects. So it's just important for people to understand that we have so many amazing non-invasive tools. Not everyone needs surgery. Not everyone wants to do surgery. Personally, myself, I love the non-invasive techniques and they're only getting better, but it's really pretty dramatic how good they are right now. So I'm really excited to be in dermatology and practicing in this day and age because we have such great tools, some of which have very, very little downtime. So it kind of depends on what is someone's concern, what do they have time for, and making like a long range plan. But I mean, I think sort of breaking it down into those aspects, the skin quality aspects, and then the structural aspects.
Recommend someone goes about choosing a
Mm.
cosmetic dermatologist?
Great question. So there are many very skilled people all over the country, all over the world. I think it really does matter who your practitioner is. I think you want a board certified dermatologist. There are a proliferation of med spas that are doing, dermatology procedures, but often those places are just no real medical supervision or training. A lot of advertising. Again, the great practices, the great doctors don't need to advertise. They're busy. So I would say to find someone, again, a great listener. You should have your concerns, really to spend a lot of time with the patient. Great listener. They need to be skilled. So there's technical skill involved in terms of getting a great outcome. And obviously people that do a lot of it tend to have more skill than someone just dabbling. They also need to have an artistic eye, and that's going to vary person to person from the practitioner. And again, that's where really listening and having the person see what is your vision for yourself, what is the doctor's vision for what is possible, what's a good idea, what's a bad idea. Then you also really need somebody with integrity, the ability to say no. Like, I
Uh-huh.
don't think that's a good idea. So this sometimes comes up in my practice. And when that comes up, I spend a lot of time educating people for why something is a good idea or a bad idea, or these are the alternatives, things we could do. This is why it's not going to be a good idea. So again, finding someone with the skill, the artistic eye, and integrity is really important. Yeah.
Those are really interesting points. They raise so many questions for me, including what do you think of when you hear women who I'm sure come into your practice and say, well, I got Botox at a Botox party.
Yeah. So I would say all of us practicing cosmetic dermatology, we're just increasingly seeing problems of people going who knows where, getting who knows what. Sometimes it's not even as advertised. So we end up spending a lot of time doing reparative work and solving situations that never should have happened to begin with. So I would say, we maybe make it seem easy. And I think social media makes it seem easy. People are filming things. And yes, these things are low complication, low risk, but it has to be done properly. So I think, it's not even often cheaper, but you'll spend more not doing something properly. So if something is not in your budget, don't don't do it. Skip it if rather than do something that you shouldn't do. But I'm
Well,
very conservative in that way. But I mean, again, seeing the reparative work that we all of us in the field are doing and seeing nowadays, it's very eye opening. So it does have to be done properly, and certain
and
things
how
should not
hard
be done at home too. That's also, there are people buying all kinds of things on the internet. It's really, pretty frightening. Some of
how
the
hard
procedures.
is that reparative work? Because what's the face life of, let's say, an injection if you have to try
It can
counter it?
be. It
Face
can
it.
it can be difficult, and it depends on what it is. So, for example, a hyaluronic acid filler, if it's not placed properly, we have hyaluronidase. It's an injection. It can be used to dissolve it. But I've seen cases where people have maybe gone out of the country and had fillers, or even in this country, and they were not given what they were told. And the filler will not dissolve with hyaluronidase, which means it is not a hyaluronic acid filler. So, and you see people with allergic reactions and granulomas and, or just, sometimes just an unsightly result that you have to wait for it to go away. So, I mean, there are things that can be done, but again, it's better to be conservative, better to do it right the first time. Yeah.
Now, something you said earlier is sometimes I have to say no.
Yes.
Those conversations unfold.
I would say typically they are okay because people, once somebody has found you and they know you and trust you, they're receptive if I take the time to explain why. Occasionally it doesn't go well and they will, sometimes in that scenario, somebody will doctor shop, they'll go somewhere else, they'll get something that I really didn't recommend. And sometimes that person comes back again, regretful. I've had patients that have done, even a facelift when they didn't need it and they had all kinds of complications and they're just kicking themselves. And so it kind of all depends. I mean, there is something called, body dysmorphic disorder where people don't perceive themselves accurately. And that's a real condition. So I have in some cases referred people to, a therapist to help treat that. And, sometimes I will also treat the person at the same time that they're getting help. But I think that's not so common as much as misinformation where people have, done a lot of research and they have one thing in their mind, but really they're better suited for something else. So,
Hmm. Can we talk about the sun? We know that vitamin D, you know, synthesizes from sunlight, and we all
mhm.
need vitamin D. We want our strong bones. We want all the other things that vitamin D is good for. Yet too much sun exposure, we know the issues that I'd like you to elaborate on
Yes,
that can happen. So from too
yes,
much sun or sunburns
right.
particular
Yeah.
and sunspots that start to show up when you're mine and say, "Oh, I should have listened to my mother when I was that baby oil and iodine on my
We all
18."
should have, yes. We didn't know. Yeah, that's a great question. So vitamin D is important. However, we can get vitamin D from supplements.
Hmm.
We know that most of aging and skin cancer, about 90% comes from UV radiation, which is from the sun. So I cannot emphasize enough preventive maintenance. It is much easier to prevent a problem than it is to correct a problem later. So I think the earlier people start with adequate sun protection, and we can talk a little bit about what that looks like, then I think the better, because really the sun damage, there's good news and bad news. The bad news is we all harbor damage that comes out decades later. So it's your entire lifestyle. It's the sun. It's the pollution. It's if someone smoked. It's maybe the unhealthy phases with unhealthy diet. So that all impacts your skin quality. And in terms of skin cancer risk, some of the damage comes out decades later. The great news is the skin is very resilient. It's able to repair. We can help it repair with protection, with topicals, with lasers. So we have great tools for decreasing the risk, helping cosmetically, helping medically to lower the rate of skin cancer. So yeah, we dermatologists were pretty much obsessed with sun protection. I'm not, however, the type of dermatologist going to tell you go live in a tent, go never go outside, live in a bubble. I love being active outside. I have a lot of patients that are very active or professional athletes. So I think it's more useful to say, what tools can we do? How do we still enjoy our lives? Nature is great. Sports are great. We want to live our lives, but we want to protect at the same time. So, in that vein, I like topical antioxidants, vitamin C products such as SkinCeuticals CE Ferulic or Froletin CF. So, if you layer antioxidants, they often help your sunscreen work better. So, daily sunscreen, just make it a habit. We all know we should do it. It's like brushing your teeth, daily sunscreen, you will protect a lot. In addition,
Okay,
hats, sunscreens. Yeah.
I have to say, Dr. Haven, I'm glad you happened to mention SkinCeuticals CE Ferulic because this morning, as I put it on,
Yeah.
and I do most mornings, I say, do I like this project product just because it stinks so bad? I psychologically think it's probably good for me, or because it really is. Because after I put it on, I'm like, oh my gosh, I need to put something on over this. I kissed somebody hello today. They're going to say, what the heck does that face smell like?
You're doing the right thing. It actually really works. The
Thank you.
an
Thanks, Lily.
interesting fact with that product actually is that, let's say you get a sunburn anywhere on your body, your shoulder, or your children get a sunburn. It actually has a little bit of a sunburn rescue mechanism. So you can put it on an acute sunburn, and then there are a little bit less of the sunburn damage cells. So it's a very good product. And, you living in New York City, it also can help with pollution, environmental pollution. So people living in cities, there's a lot of pollution that can bombard the skin and contribute to acne and aging. So some of the antioxidants can also mitigate some of that damage.
Okay, so I'm glad we covered that product. Now, let's talk about some others. On the internet, you can go on and there's this kind of facial you should do, or this kind of
Mm.
cream you should use, or this home potion you should try out. What do you recommend are as go-tos for those of us, male, female, that just want to try to look our best with some product or products that we should use on a daily basis or weekly basis or whatever?
Sure. Yeah, you're right. It is a little confusing because there are so many products. There's so much advertising and marketing. There are some great medical grade cosmeceutical products that really work. Personally, I love multitasking products. There are a lot of products that have multiple active ingredients. There's synergy. So the SkinCeuticals, that's a very good example. Vitamin C, ferulic acid. But some other great examples would be I love TNS Advanced Serum. It has antioxidants, peptides, growth factors, not irritating. So that could be used day and night. It's often nice to have a hyaluronic acid product. So that's really good for people with rosacea. The barrier function gets impaired, so there's less irritation. It's good for people as they age, they're more dry, but it's also great for acne patients because a lot of times people use so many things for acne, their skin gets irritated, it makes the acne look worse. So, a hyaluronic acid product for hydration is great. And then finally, I have to mention retinoids. Because retinoids have a big role in dermatology. They are great for acne. They are great for sun damage and aging. The only two caveats with retinoids. One is it doesn't need to be irritating to work because sometimes people just put so much on it, they think more is better and they're really irritated. They can't tolerate it. And the second is just being mindful not to get sun exposure when you're using a retinoid. So take a break if you're going on a beach vacation because you could end up with more sun damage and they're a little sun sensitizing.
Let's talk about acne because I know people that, we'll talk about they had acne when they were younger, and all of a sudden you'll hear women say, oh my gosh, I hit, perimenopause or menopause, and all of a sudden I'm
Yes,
getting acne breakouts again.
right.
So,
Yes.
what would you tell women or, anyone at any age that's dealing with acne how they can benefit from cosmetic dermatology advances?
Well, acne is really different at different ages. And even within an age group, there's lots of causes. So, again, we really need to do a very deep dive into the person. What is their nutrition status? What is their sleep? What is their stress status? The stress management tools are great for acne. Hormone status. So, there's a reason that acne comes particularly during puberty. That's a big time. And menopause. So some women going through menopause, they've never had acne in their life. They've had 100% clear skin, and it's really very, surprising and shocking to them. But we have good treatments for that. Sometimes something hormonal like spironolactone can help with that menopause-related acne. Definitely topical retinoids, because then you're getting the anti-aging as well as the acne. I also love procedures for acne. I do a procedure called PDT, photodynamic therapy, treats precancers and can help with acne. It shrinks the sebaceous glands. There's another procedure called Aviclair, which is great for severe cystic acne. It's a little painful, but it really works. Yeah.
You raised skin cancer. I think no
Yes.
conversation would be complete without taking a
True.
look at skin cancer.
Yes.
What are things people should look for on their own bodies where they should
Yes.
attention and say, well, maybe it's time to call a doctor?
Right. That is a great question. So, because a lot of people don't realize skin cancer is the number one form of cancer in America today. The great news is we've gotten much better at treating it early. There's great treatments, but early diagnosis is the best you can do for any type of cancer. So, people should basically look for something changing if something is bleeding and not healing. If something is new and changing, it might be fine, but you can't always tell on your own. So, really, you should see a board certified dermatologist to have it checked out. And often we can tell quickly by looking, but often, sometimes things need a biopsy, to treat skin cancer. And again, sun is really one of the major contributing factors. So the more you can protect, the better. And sometimes we'll see an uptick of pre-cancers or skin cancers even after someone goes on a vacation or in the middle of summer. So it's never too late to start protecting because you can lower the rate. I also love fractionated lasers. So I have a number of them in my practice. And a lot of people aren't aware they're considered cosmetic by your insurance company, but there are a lot of studies showing people that do a series of fractionated lasers, you can chip away at the sun damage risk and you can actually lower someone's rate of skin cancer. You can't bring it to zero, but you can lower it using modern technologies, modern topicals. So,
Now let's talk about the overall idea of healthy mind body well being and how this relates to your practice, to what you would encourage people when they're coming in for a treatment, and how you connect their overall life to, maybe how that treatment's going to take or how they're going to feel about it in the aftermath.
right. Well, right. How they're going to feel is often what motivates them to come in. But again, a healthy lifestyle, I keep coming back to that because it really does impact outcomes. So when we do laser resurfacing, if people smoke, they don't heal as well. If they get sun, their end results will not be, as good. And I think the healthy lifestyle and healthy skin, it goes both ways. When people take one positive step towards a healthier life, it sort of motivates them to take a lot of steps. So it motivates them to more go to the gym and focus on their nutrition, to focus on their sleep, their hydration, their stress management. Because again, our health is all interrelated. The skin is, an integral part of that in a very obvious part, but it's really part of the overall health of the person.
Can you share some thoughts about the foods that might help someone's skin
Sure.
more so than those that might not?
And so a diet is very individual, but there are some universal things that are helpful. One is the glycemic index of foods. So what that means is how quickly do certain foods or food combinations spike your blood sugar. So when your blood sugar spikes, your insulin spikes, and that can cause a lot of acne. That actually causes glycation. So glycation in the skin is it causes stiffening. People that have a lot of diabetes have a lot of skin issues and stiffening. So we want to try to avoid glycation. We want to keep the blood sugars relatively even, which doesn't mean you can't ever have sugar or, but it's about how you combine it. So your food should be mostly, healthy proteins, healthy fats, fruits and vegetables. Again, fruits and vegetables have a lot of antioxidants, and those are helpful internally and for the skin. So sometimes there are certain skin conditions where gluten is inflammatory and can make things worse. So occasionally we will recommend that, but again, that's not for everyone. And then acne, there's sort of a myth of online of like sugar and dairy causing acne. So I would say sugar, actually, that is true. It is universal that evening out the blood sugar is helpful for acne. Dairy is another story. So there's a small subset of acne patients that are sensitive to dairy and they can do a trial and give it up. And it really does make a difference in their acne. The majority of people, however, really doesn't matter. So I don't like to see people go on restrictive diets unless there's a real reason for it because it gets very cumbersome. So again, it's so individualized.
So, once someone starts to see a cosmetic dermatologist, is there a routine that they're looking at going forward? Like once you do a certain kind of treatment, I know well, I'm kind of going backwards, but it's a question
Yeah,
that pops in my head. It's kind of how my
yeah,
brain works.
yes.
Once you, let's say, do a particular treatment, is there a time frame for how often someone comes back to visit?
I'd say that's individual. I mean, there are a lot of patients in my practice that I see very regularly. Some people, they see their dermatologist more than they see their other physicians. But I think it depends on what the concerns are, what we're doing. But it is good to think in terms of maintenance, right? So it's just like you wouldn't work out once and expect to maintain. You might do a series of workouts and then you're going to need to do something to maintain. So the skin is very similar, right? It's dynamic, it's turning over. Now, there may be simple things you could do to maintain. Maybe it's just a good routine at home. But certain conditions like acne or rosacea, we can manage it, but it is more of a chronic thing. Other like things like cosmetic injectables like Botox and fillers, they do, benefit from ongoing maintenance. So some people will come very regularly, let's say for their Botox. I mean, Botox also helps with migraines. So my patients with migraines or people with TMJ, that needs to be done very regularly, or else the migraines come back or the pain comes back. Other people, they're just want to maybe freshen up before the holidays or they have a college reunion. So it's totally fine to do something like that, intermittently. So it depends on people's concerns, their budget. As a dermatologist, I always want to get rid of the sun damage. So I like people to come in regularly to remove as much of the sun damage as possible.
Sun damage, what procedures would you use for sun damage?
Often lasers. Yeah, good topicals and then lasers. Yeah. So which laser, sort of depending on how much downtime the person has.
Hmm. What's the typical recovery for a laser treatment? When you said downtime,
Could be anything from, a few hours of redness to a few days to, well, my newest laser that I'm really excited about is the Ultra Clear. And we can do full face resurfacing. It's amazing for taking away sun damage. You can also do with that laser what's called laser microcoring, where you can get a little tightening and lifting. So it makes it very unique. And it's really for all skin types, which also makes it unique because skin of color, you cannot use every single laser. You can get hyperpigmentation. So for that laser on the most aggressive settings with the coring, it might be 7 days, 7 to 10 days of downtime. But that's compared to old fashioned CO2 laser, where people would have weeks of downtime, potentially months of redness. So it's much more comfortable, it's safer, it's less downtime, and it has the tightening component. So that's what I mean that there's a real excitement in my field because things just keep getting better. So
you just said something that triggered another question: skin tone. As
it's skin tone.
skin tone, as far
Yes,
as not the texture and the toning, the color,
the
skin
pigment, right. Yes,
thickness,
yes,
and how that varies. Are there treatments that are absolutely contraindicated, for certain skin colors?
yes,
Let's say I have, you know, whiter skin that tends to, have a rosier tone to it. You have a paler skin, someone else might have browner skin or tanner
right.
skin or yellow, like gold in their skin. What
Well, in general, the lighter skin types are more forgiving, and we can use these technologies, a wider range of these technologies. I mean, all technologies need to be used properly, obviously. Darker skin types really historically have been limited that we couldn't do. You cannot do a CO2 laser, or you shouldn't, at least on someone with very dark skin type, because they will hyperpigment. And there's also going to be loss of pigment with certain lasers, like aggressive CO2, where people will lose pigment around the mouth. So this skin type really does matter, and so it's great that we have multiple new technologies that can be, useful for treating all skin types. Tan, you really don't want to treat any skin type when they're tan. So we like to minimize sun exposure pre and post procedure in order to get a good safe outcome. So certain things you can't even do when you're tan.
when I used to color my hair myself from Fox, I remember it used to say do a skin patch first.
Yes.
In work that you do you have to do testing on someone first, or is there enough clinical tests that lets you, prior to that coming to
Typically, there's enough. I mean, some people do have allergic contact dermatitis, so we do have to tailor what we do. But if someone doesn't have allergies, then they're fine to do things. Yeah, but some it's not. It's common for people to have skin allergies. So then we'll do a use test for certain products where they'll use it on their arm for a few days, and then they'll use it on the neck because that skin is very close to before they use it on the face. Yeah.
Hmm. We have covered so many things. Can you think of anything I missed for this first episode with you?
No, I think we covered a lot of ground. Yeah.
We really did. This was a very fascinating conversation. I've been talking with Dr. Lynne Haven. She is a cosmetic dermatologist, a very accomplished one, obviously extremely thoughtful in so many of the things she shared about artistry, about getting to know your patient, about really understanding the psychology behind her patients, thinking about what's the best procedure, when it's the right time, when it's the wrong time. I mean, we really covered a lot, and I want to thank you for that.
Thanks for having me.
Thank you. Okay, I'm moving over to the green room with Dr. Haven. There are going to be all kinds of links so you can get in touch with her and follow her work or maybe even go visit her. Who knows? She sees people from all over the world who stop by Greenwich to visit. And I'm Diane Roussel. This is the Silver Disobedience Perception Dynamics podcast. I want you to hit subscribe, share this with your friends, because this is an episode that certainly covered people from all ages, all skin types, and everything else in between. So thank you. Lynn, we're moving over to the green room. Thanks, everyone. Hit subscribe, share this episode.